All right, so welcome to the deep dive, everybody. Today, we're going to be looking at something that's kind of, well, honestly, a little unsettling.
Yeah, that's not the most fun topic.
But it's super important, really.
Yeah.
We're going to be kind of uncovering this hidden world of health insurance denials.
I think a lot of people don't realize just how much goes on behind the scenes.
Yeah, and specifically, focusing on these third-party reviewers. These are companies you've probably never even heard of.
Right, exactly.
But they have a huge say in whether or not you get the treatment that your doctor recommends. So for this deep dive, we're going to be looking at one single investigative report.
Oh, this is going to be juicy. I love a good deep dive.
Me too. And it's from ProPublica. They took a really, really in-depth look at a company called EviCore. Have you ever heard of EviCore?
I have. Have you?
I actually hadn't before reading this report. It's EviCore.
Yeah, they're kind of a big deal, though. Maybe not a household name, but...
Well, that's what's so crazy about it.
Yeah. What's wild is that most people, they've probably never heard of EviCore, but there's a good chance they've actually been impacted by them. I mean, EviCore, they work with these major insurance companies.
Oh, yeah, like the big ones, right?
Huge.
Yeah.
They're talking Aetna, United Healthcare, and they're making decisions about healthcare coverage for a lot of people. Over 100 million Americans.
100 million?
Yeah.
That's like a third of the country, basically.
1 in 3 people with insurance. It's a lot.
That is a lot of people. So, okay, before we kind of go any further, let's just make sure we're all on the same page about this term prior authorization.
Yes, this is key.
So basically what this means is that your doctor, they have to get approval from your insurance company before they can actually perform certain procedures.
And it makes sense on some level, right? Prior authorization is meant to, help curb healthcare costs, prevent those unnecessary treatments.
Right, so they're not just doing tons of tests on you that you don't need.
Exactly. It's a way for the insurance companies to make sure they're only paying for stuff that's actually, medically necessary. But as we'll see, sometimes it creates problems, especially when companies like EviCore get involved.
Right, because EviCore is like the middleman. Right. They review those prior authorization requests, and then they make recommendations to the insurance companies.
They basically get to decide if insurance will actually pay for that MRI, that surgery, whatever it is.
So how does a company like EviCore even make money? What's their business model?
Well, the ProPublica report, it outlines 2 main types of contracts that EviCore has with these insurance companies.
Okay.
So one is like a simple flat fee.
Mm-hmm.
For each request they review, they just get a certain amount.
Okay.
But the other type, this is where it gets interesting, these are called, quote unquote, risk contracts.
Risk contracts. Okay, that sounds kind of ominous.
A little bit, right. So under a risk contract, EviCore basically gets a financial incentive to keep costs down for the insurance company.
Yeah.
So let's say, your insurance company, they normally spend, $10 million a year on a certain type of procedure.
Okay.
And if EviCore can somehow bring that spending down, say, to $8 million, well, they get to keep some of that savings.
Wait, so they actually profit from denying care? Isn't that a conflict of interest?
It's a huge conflict of interest.
Yeah.
And that's one of the big concerns that ProPublica raised in their investigation, right?
Yeah.
When a company's financial interests are tied to denying people care, how can we be sure that the patient's needs are actually coming first?
Right. It seems like the system is kind of set up to incentivize denials, even if those denials aren't actually the best thing for the patient.
Unfortunately, yeah.
And it gets even more concerning when you consider what ProPublica uncovered about EviCore's use of an algorithm. And they actually call this algorithm the dial.
Oh, yeah, they dial. This is where it gets really interesting. So this algorithm, according to former EviCore employees, it analyzes these prior authorization requests.
Okay.
And get this, it can be tweaked to send more cases to human reviewers. And guess what? When more cases go to human reviewers, the chances of those requests getting denied, well, they go up significantly.
Hold on, so they're basically using an algorithm to potentially increase the number of denials. What's the logic behind that? I mean, why would they do that?
Well, what the ProPublica report kind of suggests is that, EviCore, they can adjust this dial to achieve specific denial rates. And those rates, well, they're influenced by pressure from the insurance companies. Of course, they want to keep costs down.
Right.
But also by EviCore's own financial goals. under those risk contracts.
So if an insurance company's like, hey, we need you to deny more claims, EviCore can just kind of tweak their algorithm to make that happen. That's scary.
It's pretty wild, right? It definitely raises some questions about how much control these algorithms really have over our healthcare. And remember, we're not just talking about, numbers on a spreadsheet. We're talking about real people's lives. A denial could mean a delay in treatment, a worsening condition. I mean, it could have really dire consequences.
Absolutely. And this brings us to the story of Little John Cupp, a 61-year-old man from Ohio. And his experience with EviCore really highlights the potential human cost of these practices.
Yeah, Mr. Cupp, he started experiencing, some pretty troubling symptoms. Shortness of breath, swelling in his legs, trouble sleeping lying down.
Yes, serious.
It was. His doctor was concerned about his heart. He recommended a heart catheterization to check for blockages.
Okay, so did he get the catheterization?
Well, that's where EviCore enters the picture. They denied the request for the catheterization. They said it wasn't, quote unquote, medically necessary.
Well, hold on. His doctor recommended the procedure, though, right?
Yeah, exactly. But EviCore, they overruled the doctor's recommendation.
Wow.
And it gets worse. Mr. Cupp's doctor, he actually appealed the decision, and EviCore denied it again.
This is starting to feel like a David and Goliath situation,
Totally. And it's important to understand, a heart cath, that typically costs around $3,500.
Mm-hmm.
EviCore, they eventually approved a nuclear stress test instead, which costs about $315.
Wow, that's quite a price difference. So what happened after the stress test?
Well, that's where things take a really, really tragic turn. So Mr. Cupp, he told his daughter that he felt, fine after the stress test.
Oh, no.
Yeah. But the results, they actually showed that his heart was in even worse shape than they initially thought. And just 36 hours later, he went into cardiac arrest and died.
Oh, that's awful. I mean, this whole thing, it makes me question everything I thought I knew about health insurance.
Yeah, it's a heartbreaking case. And it really raises some serious questions about, EviCore's role in Mr. Cupp's death. ProPublica, they actually had 4 different cardiology experts review Mr. Cupp's case.
Okay, and what did they say?
Well, one of the experts, he agreed with EviCore's decision to deny the catheterization. But the other 3 experts, they said that the procedure was absolutely appropriate given his symptoms, his age, his risk factors.
So 3 out of 4 experts believe he should have gotten the catheterization. That's pretty damning.
It is. One of the experts even said that if Mr. Cupp had received the catheterization when his doctor first requested it, well, his life might have been saved.
It's impossible to know for sure, obviously, but
of course.
But it makes you wonder.
Definitely.
And this whole thing, it's just so disturbing. I mean, it seems like EviCore is putting profits ahead of patients' lives. And what's even more unsettling is that, this isn't an isolated incident.
Right.
The ProPublica report, it highlights several other cases where EviCore's decisions have been questioned and where patients have suffered as a result.
And this brings us to another, really concerning aspect of EviCore's practices. Their internal medical guidelines. So these guidelines, they're basically used to determine which treatments are considered, quote unquote, medically necessary and therefore eligible for coverage.
So they're basically setting the standards for what they'll approve and what they'll deny.
Exactly. And the problem is these guidelines, they've actually been criticized by numerous medical organizations for being outdated, too rigid, and potentially leading to, inappropriate denials or delays in care.
Wait, so it's not just patients complaining about this. Actual medical professionals are saying that EviCore's guidelines are flawed.
Yep. ProPublica cites several examples of, respected medical organizations that have raised concerns about EviCore's guidelines. So, for instance, the Society for Vascular Surgery, they actually wrote to EviCore in 2019 expressing serious concerns about their guidelines for vascular procedures.
Wow.
And a 2023 academic study found that EviCore's criteria for approving lower spine imaging in cases of, really extreme pain were deficient.
So even the experts are saying that EviCore is getting it wrong.
Pretty much.
Yeah.
And it's not just about the guidelines themselves either. It's also about the pressure that EviCore puts on its reviewers to make decisions quickly. Yeah. ProPublica, they interviewed Dr. Gail Miller. She's a maternal fetal medicine physician.
Okay.
And she actually worked at EviCore for a while, but she left the company kind of disillusioned by what she saw.
What did she see?
Well, she described a system that was just laser focused on cost cutting, even if it meant sacrificing patient well-being.
Yeah.
She felt like there was constant pressure to review cases as quickly as possible, sometimes spending as little as 4 minutes on a case.
4 minutes. That's hardly enough time to even read a patient's chart, let alone make a, life-altering decision about their care. It reinforces this feeling that the system is rigged against the patients.
And that's the really scary part, right?
Yeah.
EviCore and companies like it, they have an enormous amount of power over our healthcare, and they're operating with very little accountability.
What do you mean by accountability?
Well, state and federal regulators, they rarely impose, harsh penalties on these companies, even when there are tons of complaints and documented issues.
So they're basically getting away with it.
Pretty much. And even when patients or their families try to, hold them legally responsible, it's incredibly difficult. Remember, Mr. Cupp's daughter, she initially sued United Healthcare and EviCore,
Oh, right.
but later dropped them from the lawsuit.
Why did she drop the lawsuit?
Well, she faced significant legal hurdles because of the way employer-funded health plans are, structured. It's that classic David and Goliath situation, and unfortunately, in these cases, Goliath usually wins.
It's just not right. I mean, patients deserve better than this. We're talking about people's health, their lives. It shouldn't be about profits and denials.
I agree, and this is why it's so important to understand how this system works. We can't just sit back and accept a system where, faceless corporations get to make these decisions without any real accountability.
So what can we do about it? Is there any hope for change?
There is. Knowledge is power, right? The more we understand about these practices, the more we can advocate for ourselves and for a better system.
I think a lot of people listening right now are probably feeling, I don't know, a little overwhelmed.
Yeah,
Maybe even a little helpless.
I get it.
It's hard to hear about cases like Mr. Cupp's and not feel, I don't know, angry, frustrated.
It is frustrating, and it's easy to feel kind of powerless when you're up against this, this massive system. But remember, we're not totally powerless. We can advocate for change.
Yeah, how? How do we even begin?
I think, first of all, we have to stay informed. Read articles like this ProPublica investigation, talk to your doctors, really educate yourself about your own insurance policy. What does it actually cover?
So knowing your rights is crucial.
Absolutely. And don't be afraid to question denials. You can ask for an explanation. You can appeal decisions that you feel are unfair. You can also reach out to, patient advocacy groups. There are a lot of organizations out there that can offer support and guidance.
Okay, that's good advice. What about those medical guidelines we talked about earlier? The ones that, are being criticized for being outdated and too rigid. Can anything be done about those?
Well, that's where policy change comes in. Right? We need to be pushing for greater oversight of these third-party reviewers. We need stricter regulations on the guidelines they use. We need to make sure those guidelines are actually based on the latest medical evidence and that they prioritize, patient well-being over just cutting costs.
And what about the algorithms? That was a bit unsettling to me, the idea that a computer program could have so much influence over our healthcare.
Yeah, the use of algorithms in healthcare, it's a really complex issue, and it's only going to become more prevalent, as technology advances. We need to be having serious conversations about how these algorithms are developed, how they're being used, and what safeguards are in place, to prevent bias and ensure fairness. Is a human always going to be in the loop? How much power are we giving these algorithms? Big questions.
It seems like there's a lot to be done.
There is. But the more we talk about these issues, the more awareness we raise, and the more pressure we put on the system to change,
Speaking of change, this ProPublica article, it also kind of got me thinking about the bigger picture. Where does this whole system of prior authorization even come from? Is it really even necessary?
Well, prior authorization was originally intended to, prevent fraud and unnecessary treatment.
Okay, yeah.
And to be fair, it can sometimes serve that purpose.
Right.
But it's become a much bigger, more complex system than it was originally intended to be.
Yeah, it seems like it's become more about controlling costs than it is about ensuring quality care.
And that's the fundamental tension at the heart of this issue, right? How do we balance the need to manage healthcare costs with the need to actually provide patients with the care that they need? It's a tough question. No easy answer.
This entire deep dive has been pretty eye-opening, to say the least. It's really made me realize, just how much power these third-party reviewers have and how vulnerable patients are within this system.
It is unsettling, but remember, you're not alone. Millions of people are affected by these practices. And by staying informed, by asking questions, by advocating for yourself and for others, you can actually help create a healthcare system that's more transparent, more accountable, and, more focused on patients' needs.
That's a great message to end on. We all have a role to play in making our healthcare system better. So to our listeners, I'd say this. Don't be afraid to speak up, to challenge the status quo, and to demand better. Your health and well-being are worth fighting for.
Couldn't have said it better myself. Knowledge is power. The more you understand about how this system works, the better equipped you'll be to navigate it and advocate for yourself and your loved ones.
That's it for this deep dive, everybody. We hope you found it informative and empowering. Until next time, stay curious, stay engaged, and stay well.